Hello everyone. Today I want to talk about the importance of proper care approaches in reducing the severity of post-traumatic stress among soldiers. As we all know, soldiers face numerous challenges and traumas in their line of duty, and these experiences can have a significant impact on their mental health and well-being. Post-traumatic stress disorder, we'll refer to it as PTSD from now on, is a common mental health condition that affects many soldiers and can have a long-lasting effect on them if left untreated. PTSD is a mental health condition that develops after a person has experienced or witnessed a traumatic event. Symptoms of PTSD can include flashbacks, nightmares, feeling of detachment, irritability, and anxiety. Soldiers are particularly vulnerable to PTSD due to the high levels of stress, trauma, and exposure to violence that they face during their services. How many stories have you heard from loved ones or on the news of veterans coming back from war, having a hard time readjusting to life outside of the military? Always on edge, always feeling like they're on the verge of panicking or exploding, or feeling emotionally numb or disconnected from their loved ones, that they feel as if they'll never be normal again. For all too many veterans, these are common experiences, lingering symptoms of PTSD. In fact, military service is the most common cause of PTSD in men. Studies have shown that up to 30% of troops who served in conflicts in Afghanistan and Iraq have PTSD. Veterans who participated in combat are significantly more likely to have PTSD. The quantity of conflicts you experience and the number of tours you completed both raise your risk of acquiring PTSD. Though many of the military members who experience mental health issues could benefit from professional treatment, about 60% of them do not seek help. Concerns about stigma are one of the most commonly mentioned options to getting care for mental health issues throughout military research. For anybody who is experiencing mental illnesses, identifying and accepting the existence of that said mental illness is already a significant challenge to accept. However, the culture and training of the military, which encourages soldiers to bite that bullet and push through challenges, can make the issue worse. Although this mindset is something important to have in a military setting, it is not really helpful when dealing with mental health issues and encourages self-medication, such as abusing alcohol or drugs. One extremely widespread concern among those who have mental illnesses is the idea of confiding in someone and hearing that is all in their head, or they should just cheer up or otherwise put up with the situation. This may further isolate and alienate the person, aggravating any existing mental health problems that they already have. In particular, veterans may be wary of being open to their problems out of fear of losing their careers, or such as being a single parent, losing the one child that they may have be taken away. However, with proper care approaches, the severity of PTSD can be reduced. Soldiers can be better equipped to manage their symptoms. So, what are the proper care approaches that help reduce the severity of PTSD among soldiers? Firstly, early identification and treatment of PTSD is something crucial. Soldiers who experience traumatic events should be screened for PTSD symptoms as soon as possible. This can be done through questionnaires, interviews, and other assessment tools as well. Early identification and treatment can help prevent the symptoms of PTSD from becoming more severe and can improve outcomes for these soldiers. Secondly, evidence-based treatments such as cognitive behavioral therapy and eye movement desensitization and reprocessing have been shown to be effective in reducing the severity of PTSD symptoms. CBT, or cognitive behavioral therapy, is a form of talk therapy that helps people change negative thought patterns and behaviors, while EMDR, that's the eye movement desensitization and reprocessing that I mentioned earlier, is a form of therapy that uses eye movements to help people process traumatic memories. These treatments have been found to be particularly effective for soldiers with PTSD. Thirdly, Support from family and friends can play a critical role in reducing the severity of PTSD symptoms. Soldiers with strong support systems are more likely to seek out help for their symptoms and are better equipped to manage their symptoms over a long-term period of time. Family and friends can provide emotional support, practice assistance, and help soldiers access treatment and other resources that they won't seek out for themselves. Fourthly, medication can also be helpful in reducing the severity of PTSD symptoms. Antidepressants and anti-anxiety medications have been shown to be effective in managing symptoms such as anxiety, depression, and insomnia. However, though, medication should not be the only use of treatment. Other therapies should be added on as well, such as CBT and EMDR, and they should be monitored closely by a medical professional. Lastly, self-practice such as exercise, mindfulness, and relaxation techniques can also help reduce the severity of PTSD symptoms. These practices can help soldiers manage their stress levels, improve their sleep, and reduce their anxiety and depression symptoms as well. Soldiers should be encouraged to incorporate these practices into their daily routines as part of their overall care of approach. In conclusion, proper care approaches are critical in reducing the severity of PTSD among soldiers. Early identification and treatment, evidence-based therapies, support from their family and friends, medications, self-care practices can all play a role in helping soldiers manage their symptoms and improve their mental health and well-being. As a society, we must prioritize the care of our soldiers and provide them with the resources and help that they need to heal from the traumas they have experienced. We have to break this stigma that surrounds mental health and encourage not only regular citizens, but also soldiers and veterans that it is not something to fear, despise, or think as a burden. We must encourage them with the help of friends and family and aid them into getting the help that they need. Thank you.